I think the best way to help support patients that are part of underrepresented communities that are going through emotional challenges with their CLL diagnosis is first understanding who they are, what they're going through, spending time to really listen to them, find out directly from them what their barriers are, what are the challenges, the concerns, the questions that they have. It's about bringing together that team that they may or may not have, but it's first understanding who is part of their team, allowing them to understand that their care partners, if they do have one, that they're part of their team, that they as patients have that seat at the table and they are part of their healthcare team as well. And it's really empowering that team to know that when they're talking about the physical aspect of the disease, the emotional aspect is also incredibly important. And it's being able to provide to them the most credible and trusted information that they need. I usually call that peeling off the onion and really finding out what is going on with the patient. They may not know sometimes that there's something going on or that there's a barrier that is preventing them from either accessing the resources that they need or even being able to thrive with the disease that they have. It's about understanding directly from them what is it that they're going through. A lot of patients don't necessarily feel comfortable sharing with others all the time that they're going through something, and they may feel that they're not resilient by opening up and really sharing directly what's going on. And not everyone will come to you and say, I'm feeling depressed, or I'm feeling anxious, or I'm having a financial barrier that is preventing me from accessing the care that I need. So I think it's really important to be present, to connect to them with resources, peer-to-peer resources, support groups, other people that look like them, that have similar challenges, that are going through a similar journey, and really making sure that all of these resources are present for them and that they're meeting them exactly where they are. I think it's first understanding what this community is going through. I think it's understanding the unique characteristics of that population and understanding that everyone expresses what they're going through very differently. Everyone acknowledges and accepts what they're going through very differently. So I think on the other side, when providing resources, it's not about telling the patient what they need, but it's more so listening and understanding to the patient and really finding out what those needs are and meeting them right there where they are. I think it's very important to open up the door and make patients feel very comfortable, and their families as well, to really speak up about who they are. And I love this concept that I call cultural humility, about patients really having that platform given to them by their healthcare team, the entire healthcare team, to allow them to understand who they are and what they do and how available and present they could be there for them. It's for the healthcare team to be better listeners, to not make any assumptions, to remove any biases that could be present, and to really allow the patient to feel comfortable, to open up, because none of these barriers will come up if that platform is not there and isn't present for them. So it's all about the patient understanding what shared decision making is, that they have a seat at the table, and also feeling that they could be listened to and that they could have a voice. What PEN typically does when we hear concerns, social determinants of health that touch specific aspects such as financial barriers, insurance concerns, transportation or lodging, we are able to link them with resources from our multiple partners that we work with that are there and present and that could provide those resources. We also have some wonderful resources to be able to provide to them that could link them to what they need and what they're looking for. I think it's important for us to understand that as amazing as support groups are and as so many patients need it and want it, we have to understand that certain patients are not always able or willing, depending on their values, their culture, their background, to really or be ready in the beginning to be able to share this information with a larger group of people. But one very important key item that we need to understand is that it's important for patients to feel seen and to interact with other people that look like them and that are going through similar challenges, that could understand what they're going through. So I think it's important to, in addition to support groups, really think about additional resources, peer-to-peer support, or one-on-one interaction with somebody else that is going through a similar journey that could be there and that could very much be present to providing those resources. Really stressing the importance of that. I think it's really providing patients and their families the opportunity to access resources in the comfort of their home. We know that a lot of patients are not well enough or may not feel comfortable leaving the house or being able to access those resources anywhere else. So at Patient Empowerment Network, a lot of our programs are available online and there for patients from the time that they are newly diagnosed all the way through end of life, and that are meeting them exactly where they are regardless of what they're looking for. And we're very happy to also be there for them and being present to link them with other resources that they may need.